And now I'd like to introduce Tanya. She is the stroke coordinator at VCU Health CMH. She has been in nursing for 27 years and obtained her nursing degree from Reynolds Community College in Richmond, Virginia. She works closely with the stroke department at VCU Medical Center. She has experience working in many different departments over the years, including medical surgical, intensive care, post-anesthesia care, emergency room, staff development, case management, coding, billing, and insurance authorizations. She has held several leadership positions of manager and director. She started out her career here, left the area to build her experience, and came back about 10 years ago. So I will turn it over to her.
Hi, everyone. Thank you for attending today. Today is my very first community outreach education Zoom, so bear with me. But I just wanted to give you a quick highlight of how my agenda is. Basically, at the beginning, I'm going to be showing a slideshow and going over a few details about knowing the signs of stroke. And then I really like to show a video from the National Institute of Health called No Stroke, Act in Time. So I'll go ahead and get started on my PowerPoint. Educating yourself about stroke can be life-changing. Knowing when someone is at risk for stroke, what a stroke is, the types of strokes there are, can help you be prepared when it's time to react. Knowing the warning signs for stroke may help you save your life or the life of someone that you love. So what is a stroke? Basically, a stroke, which is also sometimes called a brain attack, occurs when blood flow to the brain is interrupted. There are two major types of strokes, and one's ischemic and the other one is hemorrhagic. With an ischemic stroke, it's caused by a blockage of blood in the vessels in the neck of the brain or the brain, most often caused by blood clot or severe narrowing of the blood vessels. Then you have the hemorrhagic stroke, which is caused by blood vessel in the brain that breaks and bleeds into the brain. So the consequences of a stroke can be long-term disability or even death, but the good news is stroke can be prevented. So how can I lower my risk of a stroke? There are several ways. It will take some lifestyle changes. First, exercise. Regular physical activity is very important. It doesn't have to be going to the gym and lifting weights. It's just regular, consistent activity, walking, doing some videos at home, even if you're just sitting in a chair doing the videos. Eat healthy, maintain a healthy weight. Control your cholesterol. High cholesterol can cause blocked arteries, which can lead to stroke. You can lower your cholesterol with diet changes, regular physical activity, weight loss, and medication. Manage your diabetes if you have diabetes. Quit smoking. Smoking damages your arteries, making it easier for plaque to build up. And also treat your high blood pressure. High blood pressure makes your heart have to work harder. So what are the signs and symptoms of a stroke? FAST is an acronym that is universally used to help us recognize a stroke and know what to do. So it's FAST. F stands for face drooping. Ask the person to smile. Does one side of the face droop? A is for arm weakness. Ask the person to raise both arms. Does one arm drift downward? S is speech difficulty. Ask the person to repeat a simple phrase. Is their speech slurred or strange? And T is time to call 911. If you observe any of these signs, call 911 immediately. There are other signs and symptoms of stroke. You know, some are blatant, some are kind of gray. You wonder, is this a stroke that's happening? But I wanted to still give you some of the other signs and symptoms that people have. Sudden weakness or numbness of the leg, arm, or face, especially on one side. Sudden trouble walking, dizziness, loss of balance or coordination. Sudden trouble seeing or vision changes in one or both eyes. Sudden trouble speaking. Sudden confusion or trouble understanding, or a sudden severe headache with no known cause. If you suspect a stroke, please call 911 immediately. When it comes to a stroke, it is okay to overreact. Overreacting can save someone's life. So with that, I'm going to go ahead and start the video that I wanted to share.
Most people know what to do in the case of a medical emergency,
Call 911.
Call 911.
but don't know that stroke is a medical emergency.
Stroke? I don't know.
Well, you think...
What you need to do is get to a hospital as quickly as possible. Every minute counts. When her husband Robert had a stroke, Alma Shanley knew just what to do.
And he sat down in the chair and he kept staring at me, and I thought he was fooling around with me at first. And I said to him, "This is not funny, Robert."
I could not speak. All I knew, she was my wife, and I reached over and took her hand, and I couldn't remember the names of my grandchildren or my daughters. It was a complete blank.
And I said to him, "You're having a stroke. Stay here. I'm calling the ambulance."
A stroke, sometimes called a brain attack, occurs when blood flow to the brain is interrupted. That can happen if a blood vessel breaks or gets blocked by a clot. When someone has a stroke, brain cells in the immediate area begin to die because they stop getting the oxygen and nutrients they need.
Somehow we have to get the hopeful message out that there is something you can do. It's not hopeless. And I think 4 or 5 years ago that was pretty much true. But now it's changed vastly. And the change is that now you can do something.
In the past, people often struggle to live with serious disabilities after a stroke, but they don't have to accept those limitations now. Today, people have a much better chance for a complete recovery. Effective treatment is available for strokes caused by a blood clot, and that's about 80% of all strokes.
He made it to the hospital, I would say, in probably 25 minutes from when he left here, and 6 days later, he walked out of the hospital. And I think that's a miracle. I really do.
We've been able to develop a drug, TPA, which you can inject in a vein, goes through the body, but it knows where the clot is. It goes and locks onto that clot and dissolves it, and the blood starts flowing again.
New treatments can limit the disability caused by a stroke, but you need to know the signs and act in time. Here are the signs to look for in yourself or those around you. Sudden numbness or weakness in the face, arm, or leg, especially on one side of the body. Sudden confusion or trouble speaking or understanding. Sudden trouble seeing in one or both eyes. Sudden trouble walking, dizziness, loss of balance or coordination. Sudden severe headache with no known cause. If you experience any of these symptoms, you need to get to a hospital right away. Even if they go away quickly, it may still be a stroke.
Stroke is really a block or a break in a blood vessel in the brain. If it is on a specific side of the brain, usually that's the left side of the brain, then people will have a great deal of trouble either saying things or understanding things, and sometimes both.
When someone has a sudden loss of function, they should, without delay, call 911 and get to the hospital. It's that type of a medical emergency where you don't have time to call your doctor's office, you don't have time to discuss it with a friend. The patient, or more properly, the person with the patient, call 911, get to the hospital.
Because stroke injures the brain, the person having one might not realize it. In this demonstration, other people recognize the signs of a stroke and call 911.
Mom! What happened? Mom can't hear. I don't know. She just suddenly stopped.
An alert family member or bystander can be a real hero.
Mama?
Can't talk. I think she's having a stroke.
It's really worth the effort it takes to dial 911. It's hard to decide to do that. You're not always sure exactly what's going on, but it is really worth it. It's going to pay back in terms of going home and living your life.
They have to get there early to get the best treatment. They need to be examined by doctors.
Close your eyes.
They need brain scans, like CAT scans, to know what the best therapy is.
The big pictures turned out shows all the details of your brain and makes it very obvious whether there's bleeding or not in your brain.
It also helps to know if you, or those you care about, are at risk for stroke. Take Sylvia Saxton, for example. Despite high blood pressure, diabetes, and a family history, her stroke came as a surprise.
When my foot went to sleep, I hadn't thought it could be a stroke. I thought it was just when you're sitting down or laying down like you do and your foot go to sleep. I did not really connect it to the signs of a stroke.
If you have high blood pressure, you're 4 to 6 times more likely to have a stroke. Heart disease and a heart condition known as atrial fibrillation can double your risk of stroke. Your risk also increases if you smoke, have diabetes, sickle cell disease, high cholesterol, or a family history of stroke.
Strokes are preventable. They can be prevented. They can also be treated. Years ago, we couldn't do that. Now we can. We want people to be aware of their body, know those numbers, their blood pressure, their glucose, their cholesterol. All of that's important.
It's so important to just watch my health in every way. Try to watch my weight, try to keep the pressure down. It's just so important to try to stay healthy so you won't have another stroke.
Stroke touches so many American families. It's the third leading cause of death and a leading cause of serious long-term disability. But today, there is effective treatment that can prevent or reduce those disabilities. The key is know the signs, act in time. If you think someone is having a stroke, if they suddenly lose the ability to speak or the ability to move their arm or leg on one side, or if they have weakness on one side, don't wait. Call 911 immediately. You can have your life back after a stroke if you know the signs and act in time.
We can go on with our life, we can enjoy our life, we can enjoy our children, our grandchildren.
It means that Grandpapa is going to be around, that Mom's going to be there to enjoy Christmas with you. All of those things that make life worthwhile, simply because we all understood and acted on the signs of a stroke.
Okay. Look at Missy.
So that is the end of the video. Again, I really do appreciate everyone coming on, and then we want to open it up now to see if anybody had any questions.
You can either unmute your microphone or put something in the chat and we'll read it out for you. I don't see anything coming through, but Tanya, if you're able to share your screen again to show your contact information.
Let me see.
We'll give people a few more seconds to ask questions if they'd like. There you go. Looks good. All right. Well, I don't see any questions, but we appreciate you speaking to us. That was a really moving video. I hope we all learned something and can take something with us.
Well, thank y'all again.
Thank you. Thank you, Tanya.
Bye-bye, everyone.